Warm welcome to all our NMG listeners this afternoon. My name is Karen Mitchell-Moore, and I'm the Head of Healthcare for NMG Benefits. It is a privilege to welcome Dr. Kylee Montgomerie, an expert with over 20 years of experience in health and wellness. With a specialized focus on women's health today, Dr. Montgomerie brings a wealth of knowledge on how to navigate the unique challenges of modern life. She will be sharing valuable insights into how we can stay energized, build resilience, and gain confidence while prioritizing our well-being through intentional self-care. If you have any questions, if you wouldn't mind putting them into the Q&A section, and Dr. Kylee will be addressing them straight after this. But for now, please join me in welcoming Dr. Kylee Montgomerie. Over to you. Thank you.
Thanks, Karen. It's really great to be here with all of you this Women's Month. I think it's such a privilege and an honor to be able to share some knowledge and impactful insights that maybe will help. I know that women's health through the ages has a lot to touch on, but I think what I've done is put everything together that I think are our most important needs at each stage. And most of us have children, most of us are mothers. So even though none of us sitting here today are going through puberty, maybe second puberty and menopause, but we're not going through puberty, many of our daughters and our girl children are navigating this very difficult stage of their life. And I think as a mother and as a woman, you want to be able to better help your child. So our first section that we're going to go through is navigating puberty, but to help us with our teenage girls. So every stage of a woman's life brings big changes in our body and mind. Every stage has different needs, different unique health shifts, and each need needs to be met on a nutritional and an exercise level, as well as a hormonal level. So I'm going to go through them all. We're going to talk about puberty, the teen years, the reproductive adult years, and then perimenopause and postmenopause, because some of us are there and we are noticing with all the stress in our lives that menopause is hitting earlier. A lot of women early 40s, late 30s are actually now going into perimenopause. So it's important to be aware of these changes too. So puberty, let's start there. It typically begins between the ages of 8 and 13. We are seeing it now starting at earlier ages. We're finding this is because a lot of the food that we're eating, a lot of the meat, the dairy products are pumped full of antibiotics, growth hormone, etc. And these actually, unfortunately, do estrogenize a woman's system, making us, head into puberty at an earlier age. Because the thing that brings on puberty is the occurrence of estrogen in our body. And menopause is when estrogen is no longer in our body. So we are seeing it earlier. So please be aware that your young girls who used to reach puberty 12, 13, we may be seeing it 8 and 9 now, okay? This phase of our lives marks a transition from childhood to sexual maturity. And since we are seeing girls getting it younger, at 9, they may start becoming more sexually aware. We must understand this. It's the hormones that do it. And so even though we are feeling like a 9-year-old shouldn't be sexually aware, some of them are a bit more due to the changes in their body. Now, because our estrogen starts to develop at this time, it brings up different stages of development in the female body. So it is classified according to something called the Tanner stages. The first one of those being the budding of the breasts. So this is the very first visible sign of puberty. Before we hit our menses, before anything else happens, we do start with these small tender lumps under the nipple. So be aware if your young girl from as early as 8 comes to you with a little bump under her nipple, says to you, it's painful, it's sore. Understand that could be the start of the breast budding. It doesn't always occur equally. They don't bud at the same time, just like a rose bush doesn't bud all at once. So one may bud a bit before the other one. So it is normal. Don't be alarmed and think it's like a breast lump or something. It's quite normal at that age. We then start getting the development of body hair, depending on our cultural differences. Africans, Indians, it is a lot darker, but even for Caucasians, the hair starts to become coarser, darker, whereas it used to be that fine, fluffy down hair on the legs and under, well, not even under the arms, but on the legs, it starts to get a bit coarser, harder. And we started getting the development of hair in the pubic area, underarms, and usually this is about 6 months after the breasts start to bud. So it's good to maybe prepare your daughter when you start seeing the breast budding that this is going to happen. There are some girls who get very traumatized by this dark hair. I would suggest that, we are open to, some people don't want their kids to start shaving at an early age, but maybe get them some of, that no hair or VEET or even lasering you can do at a young age. But I would suggest don't do it too early, because as the hormones change, you'll be wasting your money, because as the hormones change, the laser wears off very quickly. So until they are more stabilized around 15, 16, I wouldn't waste my money on that. But maybe do waxing, help them with that. It is for some girls quite a harsh reality having this hair that they haven't had before. We then get the growth spurt, which is a rapid increase in the height, skeletal maturation. This actually happens quicker in girls than boys, by the way. So girls go through the growth spurt younger. We may get a widening of the hips and a general redistribution of body fat. Things to be aware of at this age: you may suffer badly from bone pains, those growing pains. Very good at this age to get your child onto like some magnesium. It really will help with the pain of that. Putting them in Epsom salt baths also helps a lot with if they're struggling badly with the bone pains. Good time also to sit down with your daughter, explain the differences that her body's going to change and shape. A lot of self-image problems begin at this time. Thoughts of anorexia, bulimia do come up at this time, where your body is starting to change. You're not comfortable with it moving into a more womanly shape. So it's a good time to be very upfront with your daughter, check-ins with her regularly about how she's feeling about her body changes. Talk to her. This is a time where you may have to discuss with her changes in eating plans, maybe get her into some exercise that you do with her, but be understandable that at this time the mind is very, very emotionally fragile. It can instill eating disorders if we push it too hard. The best way to approach it is just like say, Mom's going to try and start eating healthier. It's better for us. So as a family, we're going to just eat a bit better, and make it as a family thing, not like, oh, you need to go on diet. Okay, that can push her completely the other way, or cause a rebellious state where food and her are not friends, and we don't want that. We then get the lovely arrival of our first period. Please, a lot of things I've realized in practice is this is when girls haven't been prepared for it and they don't know about what's going to happen, it's very traumatic. So, once usually we've had the breast budding, realize within the next 2 years, we're probably going to start getting the first menstrual cycle beginning. Have a chat with your daughter, let her know what to expect, what it's about. Even if you just have to have a proper chat with her about what is changing, what is actually happening inside her body. Be aware also the first menstrual cycles may come with severe pains. Very good things to take are this Lady Bite, vitamin E, and essential fatty acids. Those help a lot with the pains, and evening primrose oil. So if your daughter is struggling in her first few periods with these pains, evening primrose oil, the like essential fatty acids, there's a tablet called Lady Vita and vitamin E. Those together definitely help ease the pains. They help with the passing of like clots, which are often there in the first cycles. So let your daughter be aware of what she could expect, okay? Heat packs in the area help her a lot as well. And understand that the first 1 to 2 years, you may have very irregular cycles before it settles into a proper cycle. Those are the physical shifts. Much more important are the other shifts that come afterwards. But other physical shifts include skin changes. So this is the time when we start getting pimples. So the rising of male hormones, which are androgen hormones, can activate the oil, the sweat glands, triggering acne and stronger body odor. So there are girls that go through this stage with like a much more pronounced body odor. So be cognizant of that. If you are starting to notice that, be gentle with your daughter about using new body washes, maybe some, antiperspirants, ones that just help a bit. Try not to use things that block the sweat glands, things like, why can't I think of it? The one that actually you put on and it like covers you completely for 24 hours. Those ones, those anti-sweat ones are not good for a teenage girl because they can block the sweat glands, leading to cysts that are very painful and may need to be drained by a doctor. So you can do a roll-on, but don't use an antiperspirant at this age of their life. Rather just explain to them they may need to like wash more regularly, shower in the morning and the evening. Maybe prepare them with like some body wipes that they can pack into their school bags so that they can just wipe their armpits if they are struggling with that. They may also get quite a strong like smell in their vaginal area. Give them body wipes for that as well. But talk to your girls about this. It's a very self-conscious time for them, and we need to normalize it because it is normal. The acne also, please get them a good face wash, maybe like a Cetaphil. Let them wash their face regularly with that to help, decrease the oiliness. This is also a time where we need to like think about what we're eating, try and cut down on the fattier foods, the oily fried stuff, the crisps, just because their skin is a lot more oilier at this time. If they've been sweating, ask them to keep face wipes with them for school after sport. They can wipe their face properly so that it doesn't cause blockage of the pores, which may aggravate the acne. Something I do want to stop here is like when your child, let's say they're 15, 16, even 14, 15, 16, and their skin is terrible. There are people prone to acne, extreme acne, and I've had a lot of parents ask me, should I put my child on Roaccutane? Because, there's side effects to it. So my feeling with this is, as long as you're taking Roaccutane as it should be taken, they're drinking the water they're meant to, they're staying out of the sun. If they are in the sun, they're covering up completely with a sunblock of 50, and they are being very proactive and responsible in, mitigating the side effects of the Roaccutane, fine, then they can take it. But the psychological effects on a child who are ridiculed by bad acne, the damage done to your skin by bad acne, is much more damaging than the side effects of the medication. So we have to weigh up what is more important, the psychological damage or the physical damage. And for me, the psychological damage that, acne in a teenage child has is much worse than the side effects of Roaccutane, because as long as you take it properly, the side effects are very minimal, but the psychological effects are huge. Okay. The other thing that they will start to get is a vaginal discharge, very traumatic to some girls. It can be clear or white. It's non-odorous, it's normal, and it usually appears like 6 to 12 months before the period starts. So prepare your daughter for this. Let her know that is like part of what's going on. Let her know that it's like a signal that, means he's may be starting, so that, and at this stage, get her to carry, a pad with her to school in case it starts in a place where she's not prepared. make sure you've got that. For if you are a mother who wears tampons, make sure you keep a pack of like pads with you, because on their first few periods, we don't want to start with tampons. We need like pads. So just make sure you've got them in the house. It's, a young girl who's going through this first time, she doesn't want to feel like she's now inconveniencing you. You have to run out to the shops. It becomes a big deal. The whole family know about it. So just keep it discreetly in a drawer for her when we like nearing that stage. And then neurological rewiring. So we say teenagers are different and crazy, and they are a different species. It's really true, okay? The brain does rewire during this time. New cells are generated in the amygdala, which actually process social situations. So while all this new stuff is happening, they actually don't deal well with social situations. And these shifts can cause huge mood swings, heightened anxiety, dips in self-esteem. So when your teenager is like actually telling you they don't want to go out, they're like seeming all anxious, just be a bit gentle with them. Their brains are actually physically changing. They can't adapt quickly to these changes. They do struggle a bit with it. So be a bit cognizant of that. It's not just them being difficult. Screenings at this age, okay, we should actually do growth monitoring to check that their height, weight, body mass are like on the right tracks. Mental health screenings, there are actual screenings for if you have depression in your family, if you're a bit worried, there are tools you can use, recommended at the age, starting at the age of 12. Physical things, do the blood checks every year just to be sure, plus the vision and the hearing evaluations, because sometimes we don't realize our child isn't hearing or seeing well, which can affect their like schooling. And then your immunization. So please, if you've got girl children and boy children, get them to have the HPV vaccine. It prevents cervical cancer, testicular cancer, oral cancer, and anal cancer later in life. And it's very important to do. Start them young. Children are having sex earlier. You don't want them exposed to, they are going to be exposed to HPV. Please make sure you protect them from it. Mental health in our teens. Now, this is a very scary topic at the moment because 1 in 7 young people aged 10 to 19 are facing a mental disorder globally. Those are huge statistics, okay? Most common concerns, anxiety disorders, depression, and behavioral changes. Huge impact because of the phones and social media. All for them banning social media from children before the age of 16. If you read the statistics of the link between anxiety levels and the phones, it's actually scary. Any of you who are a parent to a teen, do yourself a favor, read a book called The Anxious Generation. It's very, it's quite frightening. So be aware of, these things are happening. Anxiety is big with our kids now. We're seeing a lot of suicide in teens. And notice it in the form of excessive worry. Children who worry too much, they panic if you change plans on a whim. And it's a fear that gets involved, like takes over their daily life. Like if you say to them, okay, we decided to go out to dinner. Oh, I'm not ready. I need an hour to get ready. All this anxiety, they can't just swivel. That is like a warning sign, okay? Depression shows up sometimes as deep sadness, hopelessness, or very high irritability. Sometimes it's not a low mood, it can be extreme irritation. Issues like ADHD and conduct challenges show up now. And then we have other struggles, eating disorders, substance abuse, self-harm. So be aware the mental picture is quite profound at the moment and quite diverse. Warning signs, mood changes, withdrawal, sleep or food shifts, okay? School troubles, like with grades dropping. The way to help, talk to them and listen without judging, okay? Just let them talk. A lovely thing I read it was this group of people who anxiety in their teens was very low. So they did studies on what that group of like cultural group did. And the one thing that they said is they made it a standard thing that after dinner every night, everyone at the table shared something from the day that made them feel uncomfortable, whether it was something that scared them, made them be afraid, overwhelmed. So it was an open forum just to share the bad stuff of your day. So maybe as a parent, you can start say, oh, someone at work overrode my idea, or I just felt flat today. Share. And because they now face their fears and they are spoken about, they don't carry them to bed. And unfortunately, our new society is all about, slap on a happy face, let's just get going, move past it, put it out your mind. That doesn't work for children. They can't just put it out their mind. They can pretend to you, and then the lights go off at night and all these fears come back, causing bad sleep habits, leading to anxiety that they aren't expressing. So normalize having bad stuff happen in the day. Talk to them and make it a normal thing. After dinner, we all sit for 15 minutes and we talk about stuff in our day. Good, bad, ugly, it doesn't matter, but it's a sharing space that's safe. And that's very important. Studies have shown by doing that, it lowers anxiety in children. The nutritional needs, okay, they are developing rapidly and they need more nutritional inputs at this time. We need to make sure that teenage girls are eating between 1,600 and 2,500 calories. It's a very bad time for girls to be cutting back on calories. It damages, their development, not just for their bodies, but their brain too. So out of their calories, 10 to 30% should be coming from protein, okay? But they actually need a lot more carbohydrates than, say, the menopausal woman because of the rapid brain needs at this time and a lot of the body needs. So actually, they need quite a lot of carbohydrates, up to 60% of their diet carbohydrates. Micronutrients, calcium and magnesium, very important for the bone health. And we find this in milk, yogurt, cheese, okay? But please, if we can, and we're having a lot of dairy, try and make sure it's a healthier form of dairy, not one that's got a lot of antibiotics and growth hormones in, because that can affect their estrogen quite a lot and cause weight gain. Vitamin D found in our egg yolks, fatty fish, and vitamin D fortified foods, also very important for serotonin and production of serotonin, the happy hormone in the brain, very necessary for teenagers. Iron, very important for girls. They are going to lose it during menstruation. They need more of it, so they need to have more of that. Zinc, very important for normal sexual maturation at this age and their immune health because of all the changes in their body. And then folate. So we need it when we're pregnant. We also need it when we are teenagers for DNA synthesis, for new red blood cells. So these are things that are important in their diets. Things that we should establish with them, getting them to drink enough water. They need it, okay? Please, water, they need it for their brain. They're doing a lot of sports at school. They have to drink more. It also prevents overeating and sugar cravings. Healthy fats, very important for their brains at this stage. And to try and get teenage girls, especially again, away from this idea that fats are bad for you. There are good fats, the ones that are in salmon, avocado, walnuts, nuts. They shouldn't be staying away from that. And to try and get consistency with meals. Also important to have mealtime at a regular time because it helps with routine, and children that don't have routine do experience more anxiety. So there must be meal times at the same set time, sleep times at the same set time. And then exercise. So teenage girls need at least 60 minutes of physical activity daily, okay, which is a combination of cardio and weights. In their teens, they actually need more cardio and high impact cardio, running, aerobics, those sort of things. And especially if it can be a fun activity like dancing, Zumba, they do better with that. And then with light resistance and beginner bands, not heavy weights. Whereas a menopausal woman should be doing less cardio and more heavy weights. Okay, so different depending on the ages. We then get to our 18 to 40s. Okay, so this is our reproductive years. Our body has reached full physical growth. Okay, Our monthly periods are regular, fertility is at its highest point, pregnancy and birth happen during these years, but stress, work, and family life are what become challenges to us, okay? And bone mass reaches its peak strength around 30. That is why after 30, we need to start looking into doing things to protect that bone mass from disappearing. Our health challenges during this time: managing hormonal conditions and reproductive conditions like PCOS, endometriosis, our polycystic ovary syndrome, all of those do come into play. Things that we notice with these are irregular periods, painful periods, extremely unpleasant menstrual cycles, heavy menstrual cycles, problems with fertility, bloating, and discomfort. If you are getting those, please go see your gynecologist. Don't think just because my mother had it or my sister has it, it's normal. A lot of these things can be caused from cysts, they can be caused from fibroids. You need to get it checked out. There is help for you, okay? You also need to make sure that if you are on the oral contraceptive pill, there's not a one size fits all for everyone. Some women have more estrogen than others. Some have more testosterone. Some have more progesterone. And the balance between those three can affect your reproductive and mental health so much. So people with very high estrogen levels are going to struggle often a lot more with like PCOS, whereas someone with high testosterone has other issues. So before you just go onto an oral contraceptive pill, I would suggest, and even if you are talking to your daughters about it, go to the gynecologist, do your blood tests for the three hormones, see what their levels are. Based on that, make your choice of what like reproductive or oral contraceptive pill you should take. For instance, someone like me, my whole life I've had very low estrogen. So a pill like Trifasal, which is the one they often give in the government clinics, worked brilliantly for me. It's a high dose estrogen tablet. I felt so normal on that tablet because I had low estrogen. So it balanced my estrogen. My friend who went on to estrogen blew up like a house. In a month, she put on 8 kilograms because her system was already more curvy. Her system was more estrogenized than me. Someone like her put on a pill like that puts her more at risk for ovarian and breast cancers. Not the best pill for her. When I tried to go on Yaz, which is more a progesterone-based pill, I wanted to commit suicide. I won't even joke with you. I felt like I had PMS the entire month. All I wanted to do was cry. I gained weight, and it's meant to be a low dose pill, not the right pill for me. So why are we doing hit and miss with our hormones when our hormones can completely mess up your entire mental and emotional state of being? Please go and get your bloods tested before you go into an oral contraceptive. At these ages, we also have to balance high stress with our mental health. Our life balance becomes very important. We are now building our peak bone mass, so we need to feed our body and train for that. We may be navigating fertility and family planning issues, okay? And we also need to lay down the foundation for preventing disease in the later decades, okay? These are the years we have to look after our body because we cash in after this on that. So our reproductive and hormonal health, the things that we are looking out for at these stages: polycystic ovary syndrome. So the symptoms of these: irregular periods, acne, weight changes, and metabolic shifts. So you start like gaining weight, your body is changing shape. You're noticing any of this, you get it checked, okay? Endometriosis, one of the biggest causes of infertility, and because of our stress levels now, the type A personality that is being bred through the stress levels, endometriosis is peaking. It leads to chronic pelvic pain, heavy bleeding, and potential fertility problems long term. Thyroid imbalances, so often as we hit our later 30s, we start getting problems with our thyroid. This can affect our energy, our mood, and our menstrual cycle. And then fertility tracking. So we need to start, if we're wanting to fall pregnant, understanding ovulation, and planning for that. always good to get help with this. If you're not feeling right, get it checked out. Too many women suffer in silence, thinking, oh, well, suffer along, it's not so bad. But anything that is disrupting your normal day-to-day enjoyment of life, please go and get it seen to. Our mental well-being and lifestyle. So stress and burnout are showing up here, juggling our career, our relationships, early family life does spike anxiety and depression risks. If you're starting to feel like this, it is good to maybe speak to someone, look into things that can calm your level. There's a lovely stress B complex or stress away that are natural, treatments for it. Please remember, if you're going to take St. John's wort, which is the natural like antidepressant, it does affect your oral contraceptive pill. So we have a lot of women taking St. John's wort for depression and ending up pregnant. So it like counteracts the effect of the pill. So we don't want to be depressed and pregnant. So please remember that, okay? Nutritional gaps. During this stage of our life, iron deficiency anemia comes up quite a lot. There are a lot of women who are lacking in iron. You may need iron drips. It's something you should check. It affects your energy. It affects your weight, okay? So we need, and often you can't get enough of it in your diet. So very important to look into that. And sleep deprivation. So these fast-paced routines do affect and disrupt our restorative sleep patterns. Unfortunately, low sleep leads to weight gain, anxiety, decreased reflexes, inability to function properly. So we need to really protect that at all costs. I would prefer that we don't get onto like sleeping tablets. They've got some, they do become like quite addictive, but there are nice things like valerian root. Those of you who are really struggling, what really works is Allergex, the drowsy one, the yellow one. Take Allergex, it helps you sleep. It actually has much less side effects than, the sleeping tablets. And if you're someone who suffers from hay fever, sinus allergies, it also keeps your airways clear during the night, making for a better sleep and preventing postnasal drip. So it's a little life hack, but Allergex works quite well for that. Now, the preventative care we need to do to prevent long-term risks, okay? So it's like almost like you have to save in your bank account so that for retirement you've got enough. We have to save in our health bank so we've got enough for when we retire too. So our bone density peaks around 30, okay? So we now, after 30, need to make sure we're taking calcium, vitamin D, and we start increasing our weight-bearing exercise. So in our teens and early 20s, lots of cardio, high-impact exercise, lighter weights, perfect for you. In your 30s, though, now we have to start doing heavier weights, weight-bearing exercise, resistance training, as well as cardio, okay, to prevent later osteoporosis. Very important to start with your cervical screenings. We now need to do your routine pap smears. HPV checks need to be done. If you were vaccinated for HPV, if you go for your pap smear, you have to request that they test for HPV, because a routine pap smear doesn't test for HPV. They will only test for HPV if you get an abnormal cell, okay, or you get abnormal cells coming back on the pap smear. The problem is HPV can stay dormant in your body for decades and only show up later in life. But if you know it's there earlier on, you can take the vaccine and we can prevent it from leading to cervical cancer. So next time you have a PAP, please tell them you want the HPV screening done too, okay? And your pap smears should start taking place, from the age of 21. Breast screenings, mammograms from 35, okay. If you've got breast cancer in your family, I would suggest starting from 30. Skin health, melanoma and skin cancer, we do live in South Africa, so it rises, we're out in the sun when we're young, so we're seeing a big increase in skin cancers now, okay. Please get your mole mapping done. Go to the doctor, do your moles. Every year, go and check that they haven't changed. Check your moles for the A, B, C, D, E's. So A for asymmetry, B, to make sure the borders are smooth. C, that the color is the same the whole way through. D, for the size. And E, for evolving. So if your mole or your freckle has changed color, it's itchy, it's scabby, it's flaking, anything like that, whether it's like a patch of skin that keeps dry and keeps getting dry and flaky or is rougher, please get it checked. Okay. We must, from age 35, start doing a colonoscopy and gastroscopy. I'm sure most of you who live in the social media age know about Danny Kaye's wife dying of colon cancer at 41. This is unheard of, okay? We don't, normally they tell you only to start screening for it at 45, which shows you we actually have to start screening for colon cancer at 35, okay? If you have struggled with stomach issues, heartburn, anything like that, you start screening even earlier, okay? Please, it's the only way we can pick up cancers inside our body and our bowel is through a colonoscopy and a gastroscopy. They are slow-growing cancers most of the time, so if you are given the all clear, you only have to do it every 5 years. But we just lost a really healthy, fit person to colon cancer. It should be a wake-up call to all of us. Amylase, this is one they never tell you to test, and I learned about it myself. Amylase is the only warning sign you have of pancreatic cancer. Anyone who knows anyone who's had pancreatic cancer, you are diagnosed and you are dead within 6 months, okay? Because by the time it shows up with symptoms, it's already spread everywhere. Amylase tells you if anything is going wrong with the pancreas. That can mean diabetes, it can mean high cholesterol, it can mean fatty liver, and it can mean pancreatic cancer or pancreatitis. Get it checked once a year. It's a simple blood test, tell you what's going on with your pancreas. And then your usual health screenings, blood pressure, glucose, cholesterol, and HIV every 6 months. We need to do those. So here are the tests we need to do as a female. Glaucoma for your eyes between 20 and 29, okay? Those, and then after 30 to 39, you should keep doing those, okay? Diabetes, as I said, breast screenings. Breast cancer screening, your own screening, and screening with a doctor just to check everything's okay. After 35, mammograms. Bone mineral density test between the ages of after 50 and particularly after menopause, check it, okay? Cholesterol, LDL and HDL, very important. And then it's always good now and then just to do a test for, if you've had any discharge that doesn't smell great, to do some of the STD screening, your HPV screening, and doing your colonoscopy and your gastroscopy. Nutrition in these years, okay, so the most important things you need: iron, calcium, vitamin B, and folate, okay? As we have got pregnant, this also helps with pregnancy, focus on foods that have got lots of color. That way you're covering your spectrum of vitamins and minerals. So for building, we need calcium and vitamin D, okay? Iron is to, replace our monthly loss in our periods, to protect our DNA and not just ours, but if we are falling pregnant, we need folate. And then magnesium, okay? We always need magnesium for stress, for sleep, for bone health, and for PMS, by the way. So nutritional focus, we've got to have protein to maintain the muscle mass. We've got to have fiber for our gut health and for constipation, because it's always in these age groups, 30 and 40, we start getting constipated. Omega-3 for your heart and to reduce inflammation, and antioxidants just to combat daily stress. So eat your leafy greens, okay, and your beans, lentils. Get like a healthy drink. I mean, I prefer an oat milk or an almond milk, which also give you the calcium. Fish, very important, especially the salmons, the tunas, and try and cut back on the processed stuff and the sugary drinks. Exercise-wise, resistance training and a bit of cardio, okay, with like zone 2 cardio. This mix is important because it's like when you're peaking with your bone mass, lifting weights locks in strong bones for life, okay? our natural muscle mass starts to decline after 30, so we need to lock in muscle mass as well. Keeps your metabolism up too. Running only burns calories when you are running, okay? Cardio only burns during cardio. Weights burns after, okay? We need more muscle, okay, for long-term calorie burning. Good exercises, squats and lunges, deadlifts and bent over rows, push-ups and planks, and brisk walking and steady running are very good, okay? Those are very important. So do these exercises for your 20s, 30s, and 40s. And now we hit this lovely time of year, or life time, perimenopause. So this is a transition stage between our reproductive years and our non-reproductive years. Okay, our hormones start to fluctuate and they start gradually declining, starting usually in a woman's 40s and as early as their early 40s. Common signs, irregular periods, your periods start to change. You may get shorter periods, lighter periods, heavier periods, bigger gaps in between. And sometimes you'll have a period and 2 weeks later have another and then wait 2 months. So there'll be changes in that. Some of the other signs are the hot flushes. Everyone talks about the hot flushes, okay? Sleep disruptions. And this is not just from the hot flushes. It's like you literally wake up at 3 a.m. and you're wide awake. And then you only get tired again at like 5:30 when it's time to get up for work. So you end up being very sleepy, very tired. Mood changes as well can occur during this time. And people never talk about that. They talk about the hot flushes, the bone health. No one tells you you can become psycho, okay? So remember we had puberty where there was the change in the brain, the menopause too. And the thing is, we can call it puberty like round 2. You actually can become cranky, irritable, highly irritable, overwhelmed by social settings, not able to cope with changes or adapt quickly. It's a very awkward time in our life. And our body shifts as well. So we lose our bone density, the metabolism starts to change, slow down. So we do start getting weight gain. When we're getting to this stage, there's some tests you can do to see if you're going into menopause because there are hormone changes. So number one, your FSH and your estradiol. So if you want to know, are you heading into perimenopause, test just those two. Because what you'll notice is the estradiol has come down significantly and the FSH has gone up. Okay, so when we're going into perimenopause, those two things will change. Once we know we're in perimenopause, we can test these other things because they need to be balanced. If you're going into hormone replacement, we need to know what's going on. Cortisol, okay? So estrogen is very protective of our stress system. When we are stressed, the body releases more estrogen to bring down the cortisol. When we have low estrogen, cortisol rises, making us more stressed, okay? Cortisol also puts fat around our tummy. So a lot of women who hit menopause and don't go onto estrogen replacement tend to end up with depression, anxiety, and weight gain around the stomach, okay? Because they don't have that protective element of estrogen to keep it under control. Even for women on hormone replacement, once you get it balanced and you know what your levels, what you need to take every day, during periods of acute stress, you actually have to double up your estrogen because your body would do it normally. But once you're on hormone replacement, you're on a standardized dose daily, but you need to then self-regulate and know, okay, I'm going through a period of stress and double up your estrogen for that, okay? We need to check our testosterone. So women also have testosterone. During menopause, testosterone decreases, which is responsible for lack of sex drive, lack of energy, weight gain, and loss of muscle tone. Okay, so we need testosterone desperately during this time. It doesn't help if you're just going and they're giving you estrogen supplementation. We probably need testosterone too, particularly if you're someone who does a lot of exercise. We need to check. Oh, sorry, I forgot to put it in here. Is progesterone also needs to be tested. Okay, progesterone is the hormone that controls your mood, your sleep, and your brain. Okay, so when progesterone is low, we get anxious, we get moody, we get irritable, we want to kill our husbands, we want to kill our children, we are weepy, moody, unable to sleep, and we have brain fog. So progesterone helps all of those. So each hormone, estrogen, testosterone, and progesterone, play different roles in managing the symptoms of perimenopause. Estrogen is responsible for helping with the hot flashes, keeping the weight down. But not only that, it's important for dementia. So estrogen protects your brain from dementia and Alzheimer's. It protects your bones from losing bone density. It protects you from gaining weight. It helps your moods, okay? It is very important. So all three of these play different roles and need to be balanced accordingly. So just like for your oral contraceptive, when we head into this zone, we should actually have all our blood works done and our medication made up in accordance with our person. Not like everyone's different. So maybe you need more estrogen than me and vice versa. We shouldn't be doing a one size fits all. And my gynecologist actually said to me, he said, Kylee, we study 2 chapters on menopause when we study. We are not equipped to treat a menopausal woman, okay? Go to an endocrinologist or go to a doctor who specializes in female aging. Those are the people you need. There's a very good one, Dr. Terry Cerebro. She's brilliant. She's in Norwood. And there's Dr. Gijs du Plessis in Woodmead. They are brilliant, okay? If you want their details, I'll put it in the chat box after the talk. But go to someone who understands you as a woman, okay? Don't just go to someone who gives you one size fits all. Our main challenges during this time, okay? The physical symptoms like our irregular periods, our hot flashes, sleep, body changes, and then our mental and emotional health, our like mood swings. There's irritability, anxiety, sadness without warning. You can understand why our families think we are going crazy, okay? Brain fog is very real. Unable to focus, unable to concentrate. Our body gets long-term body changes, redistribution of fat, okay, more around our hips and our stomach. We start getting vaginal and bladder shifts. So because of the thinning of the vaginal walls, sex becomes painful. We get bladder infections. We don't lubricate as easily, and it actually can cause a lot of problems in our relationships as well, because the men who don't understand menopause think we're not like attracted to them because we're not getting turned on. In the meantime, it's sore for us. We're suffering with bladder infections. The estrogen is amazing for that. Even those of you who don't want to take systemic estrogen, you can do vaginal estrogen. It's just a tablet you insert every second day. Just helps the vaginal lining like re-establish its velvetiness and stop feeling like dry, scratchy grass. And it really makes it a lot more comfortable, to have sex. And then our bone density starts to decrease, and estrogen is very important in protecting you from that. So treatment options, we've got the vaginal estrogen. We've also got the normal estrogen in our HRT. So our hormone replacement therapy consists of progesterone, testosterone, and estrogen. So I actually take all three. I'll show you my little ones. I do the Idexis, which are the estrogen at night, testosterone in the morning, and then a progesterone tablet at night, okay? Natural options, exercise, doing a lot more heavy weights and bone, like weight-bearing exercise to prevent bone loss. Nutrition, just to be more cautious with that, so that we can also do a lot of the phytoestrogen, soya, which help a bit with the hot flashes. But I always say to people who don't want to take hormone replacement because they worry about side effects. I've had cancer twice. Trust me, the bioidentical creams like this one, the bioidentical estrogen, does not stimulate estrogen like problematic estrogen, like for breast cancer and ovarian cancer. So it doesn't put you more at risk. And if you don't want to take hormone replacement, we have to take so many other drugs to deal with all the side effects that just estrogen can fix. So we have to take antidepressants, okay? We have to take anti-anxieties, mood stabilizers. People even take anticonvulsants to sleep, sleeping tablets, pain tablets for the joint pain we get from it, antihypertensives, because estrogen protects the heart from blood pressure and estrogen. So now we're on statins and antihypertensives. All these drugs just, whereas like estrogen would help with all of that, okay? Other alternatives, complementary and alternatives, soy isoflavonoids to help with the side effects of the what estrogen would help. So they help with the sleeping, they help a bit with the hot flushes. Herbs, there's black cohosh, there's cranberry, St. John's wort, and valerian for the sleeping and the depression. We can also get over-the-counter hormones and dietary supplements like topical progesterone, melatonin, which also helps with the sleeping. Other changes we can do, relaxation techniques like yoga, meditation for the moodiness, for the irritability, for the anxiety, eating healthier, making sure you get a lot of your leafy greens, exercising, try and avoid the things that trigger hot flushes like caffeine, alcohol, spicy foods, hot things. Dress in layers, you can take them off. So people think you're mad. It's like layers off, layers on, layers off, layers on, but layering helps. Consume your cold drinks, okay? And then try and reduce the sexual discomfort and increase sensitivity with moisturizers, lubricants, vibrators. I know sometimes we're in relationships where our partner feels like this isn't, offensive to them, but maybe just add it in as like, okay, let's do something a bit more exciting, try something different, and talk to them about it, okay? Explain what's going on in your body. Make them listen to a menopausal podcast so they can understand. Nutrition, the most important things during this time is to protect your bone and heart health, to maintain your muscle mass, and to stabilize your mood, okay? So the key focus, those are protein for prevent. So whereas like a girl in her teens needs a lot of carbohydrates and less protein, we flip. We need a lot more protein, less carbohydrates, okay? We need calcium and vitamin D to protect the bone density and lowering osteoporosis risk. Fiber, because the bowels do get a bit more sluggish. Omega fatty acids for the skin. It helps because estrogen, it also protects you from aging in your skin because of the collagen and the elastin. When we lose estrogen, we are more prone to plantar fasciitis, we're more prone to joint issues, we're more prone to aging and wrinkles, okay? So we do need more omega-3 fatty acids to protect the joints for the skin. Phytoestrogens, these definitely help with like smooth the transitional, the hormone transitions, and try and limit, caffeine, alcohol, sugar, and refined carbs. We don't handle them that well during menopause. Exercise, most important is our strength training, okay? Cardio, we need to stop with the hardcore cardio. Hardcore running and that for a perimenopausal and postmenopausal woman actually spikes your cortisol levels. You need calmer exercise, walking, swimming, Pilates, those are better for you. And then lifting heavy weights. So the heaviest weights you can lift is the best thing you can do. And I've been a runner my whole life. So this was a big shift in my mindset too. But trust me, it doesn't make you get bigger. It may put on muscle density, so you may weigh more, but trust me, your clothes don't get bigger, okay? I mean, don't feel tighter. It's much better to build the muscle than keep on running. It's not good for a menopausal woman. So now we hit post-menopause. This is once we've transitioned to menopause, and now we are post-menopausal, okay? This is when we've had 12 months consecutively without a period. At this stage, we need to stabilize our estrogen, and our main focus is to protect bone strength and support our heart, because as soon as estrogen goes down, cholesterol goes up. I saw it in myself. My cholesterol jumped to 7.2 straight when I hit perimenopause. Once on estrogen, it dropped back down to 4.2. So I had a choice. I could go on statins or estrogen. Estrogen's got much lower side effects than statins. So lifestyle counseling when we get to midlife, okay, we need to be much more cautious now. Our bodies don't handle tobacco, alcohol, and medication as well as it used to, okay. We need to try and limit high fat diets because of our heart protection, keep our calories lower, lots of fresh fruits and vegetables. Make sure you are getting in your vitamins and you're doing physical exercise on a regular basis. And we need to prevent injuries because at this stage, our bones are getting weaker, our muscle density is decreasing, our stabilization is not as good. That's why Pilates is so important, to stabilize your core, to protect you from falls, okay? So wherever you can wear, so it's funny, where your seatbelt is, wear a pad, because when we get, if we jerk in it, it can hurt your bones more in a older woman, okay? Can even break the shoulder if you have a sharp like stop, okay? Make sure if you're doing like cycling, wear your helmets, okay? Make sure like in an older person's home that there are, smoke and carbon monoxide detectors. Just, be careful. Also, one thing you need to know is that when we are menopausal and postmenopausal, everyone is on this hype about ice baths. Do you know that a menopausal woman, it's the worst thing you can do? It's a shock to your system. It raises your cortisol. Men, it's brilliant for, not for women. So again, one size doesn't fit all. It's not right for women, okay? Please understand, even though you can't have babies, you can still get a sexually transmitted infection, okay? Especially with the thinner lining of the vaginal wall, you are more prone to STDs. So you still have to use condoms, okay? It's not if you are with new partners or we really, just because we can't fall pregnant, you can still get an STD. So we need to look after that. Okay, so just in time, now I can go back and see if there are any questions in the chat box. Karen, can you see any questions? I'm not seeing any here.
Yes. Hi, Kylie. Just
Hi.
a few questions. The first one being, please repeat the name of the book.
Oh, the anxious generation.
Okay. The next question, what sanitary pad do you suggest after the findings by the University of Free State?
So, you know what? I think I've always used, like the Always Ultra. I've always used those. But I think, sometimes it's one batch or something. I'm still waiting to see what else they say. But I mean, I think every sanitary pad or tampon can, if you keep it on too long, can have problems. So I would just say make sure if you are keeping them, you are changing them on a regular basis, even if you are light flow. I mean, I had a friend who actually could keep a tampon in the whole day because her flow was so light, but she still had to, you must still change them. So I'll actually get back to you on which one I would think is best. I've actually got a friend looking into that now. So Corin's put my email. Could you pop me an email, say, hi, Kylie, I asked about the sanitary pad, and then I'll respond to you on that.
Okay, great. Thanks. This is extremely useful. Thank you. I know it's Women's Month and the focus is around females, but just checking if there's any data for boys, teenage boys. I have 15-year-old twins.
So, Megan, I don't know which data you're wanting, but if we're talking about anxiety, we're actually finding that anxiety in the boys is worse. Teenage boys, they are actually saying, are 27% more anxious than teenage girls. They are struggling a lot more, especially with like their sense of identity and where they fit in the world, because like it's a very different world for them now, and they are navigating also gender crises and that, because like the masculine boy of the past is not really the boy of today. And so a lot of boys are trying to figure out where they fit in with everything. And a lot of the girls are a lot more capable. So we're finding anxiety in boys, and the effect of the screens on boys is worse than on girls, funny enough, based on their brains develop slightly slower than women's. So, well, girls. So boys on their phones are much more prone to anxiety due to social media like inputs. So they can't actually discern as easily as a girl. So they are struggling more with the social media stuff and anxiety related to screen time than the girls. So I wasn't sure if that was the data you wanted, but if we're talking about that, that is some of the info I have for that.
Okay, and of course, she can reach out to you on your email.
Mm.
After a hysterectomy, do you still need to do a pap smear?
Yeah, no. Well, if you've had a hysterectomy, you don't have anything to smear anymore. So no, you don't have to have a hysterectomy anymore. However, if you've still got your ovaries, you should go every 2 years to do a scan of your ovaries, because if your ovaries are still in there, you can still get ovarian cancer. So you can't do a pap because there's no there's no uterus there, but the ovaries can still get cancer. So if you had a hysterectomy and they left the ovaries in, just do a scan every 2 years.
Okay, great. Is it possible for ladies in their late 30s to get menopause?
100%. I had a friend who hit menopause at 38. So early menopause can be caused by high levels of stress, problems with your thyroid, fertility treatments in your earlier years, or radiation or cancer treatments in your earlier years. All of those can lead to earlier menopause. Also, if you were very involved in heavy weightlifting sport, or you supplemented with testosterone supplements in your younger years, that can also lead to earlier menopause.
Okay, where does collagen fit into all of this, and how important is it as a supplement?
Okay, so collagen is, so if you're taking estrogen, your body actually like produces it, makes its own collagen. Okay, so that's why as we get older and estrogen drops off, our skin gets more wrinkly, so to speak. Okay, so we age as collagen like depletes, and as we get older, collagen decreases, which also causes joint pain. So collagen is an important supplement. It is something that helps with the ligaments, it helps with the joints, it helps with the muscles, helps with aging. But they always want us to buy these extremely expensive collagen supplements, which are like everyone's trying to budget. Everything is expensive, and like 600 Rand a month for collagen supplementation is a lot. So the best collagen you can have if you are not vegetarian is take all the leftover bones from your chicken carcass or your lamb chops, boil them up into a bone broth, and drink 1 glass of bone broth daily. Okay, that is the best form of collagen you can get. It's the form that is like actually absorbed by the body best, and it's cheap. I mean, it's free. It's basically what you were going to throw away, but that's the best form of collagen you can get. And bone broth is very important for your body, and it really is good for you. You can even do it for your animals. Like if you've got a bigger dog, like Alsatians and that, they get arthritis, giving them bone broth, you pour it over their food, is also very good for them as well. So thank you for that.
Is it possible for ladies in their late 30s? Oh, no, we've done that, into menopause. Let's just see here. Which magnesium should we be taking after 40?
I see there was one just before that, risk of pregnancy at the age of 43. 100%. Even if you're in perimenopause and your periods are irregular, you can still fall pregnant. Okay, so if you're still having periods, even if they are erratic, you can still fall pregnant. Okay, so I mean, look at Cameron Diaz. She had a baby at 51. So you can definitely fall. I mean, my best friend had a baby at 48. So her last child, she had 4 kids, last one at 48. So you definitely can fall pregnant. Until your period stop, you can fall pregnant. Which magnesium should we be taking after 40? Magnesium glycinate is the best one for you.
Great. Let me just see here. What can cause extreme weight loss after going onto a contraceptive injection?
Okay, so now that is an extremely like unusual response. Very few women lose weight after going onto the injection. Most women gain weight going onto it. So I would actually like you to do your bloods, because a contraceptive injection very rarely causes extreme weight loss. And if you are having extreme weight loss, that contraceptive injection is not agreeing with your body. What it could have done is sped up if it was a very high dose estrogen, you actually could have like sparked a type of hyperthyroidism, which is like an overly active thyroid, which can cause that extreme weight loss. So I'd actually like you just to go and get that checked out, because it shouldn't happen when you go on to the contraceptive injection. Usually the more common thing is that you gain weight. So if you've lost it, it sparked something else in your body to like overreact. So I would get that checked out.
Okay. Is there a supplement good for combating vaginal yeast?
You know what? There's not really a supplement for combating vaginal yeast. The best thing that you can do, though, is stay away from sugar. Sugar definitely flares up yeast infections. Wheat products, so any breads, anything that's made with wheat, especially if it's like, wheat and yeast. So like breads or like muffins, cakes, croissants, anything that rises, that will actually flare it up. Other things that also flare up yeast infections are mushrooms, by the way. So things that have a lot of mushroom or cream in it, cheeses as well. So if we are struggling, there's not a supplement for it, but there are foods to cut out. So wheat, dairy, mushrooms, and sugar. Those are the things that you'd need to cut down.
Okay. Does premenopause cause flaking on legs?
100%, because the estrogen also is protective to the skin. It almost lubricates and nourishes the skin. So in perimenopause, you may get flaky skin, itchy skin, very dry skin, and it doesn't just always happen on the legs, it can be on the arms as well. So 100%, it does cause dryness of the skin, which can cause itching or flaking.
Okay. What is the name of the vaccine for girls you mentioned earlier?
HPV. So it's the human papilloma virus, HPV. So you can get it at Clicks and Discam. They'll do it for the girls as well there.
Okay, and somebody's asking as well, you said boys also need to go for the HPV vaccine. At what age?
So they can also go from the age of like 10, boys can go and get it done. I just believe like if everyone got vaccinated from HPV for HPV, we could eradicate it from the like whole population, just like smallpox was eradicated. And if we can eradicate it from the population and no one else is passing it on, 87% of cases of cervical cancer will actually be prevented. So, boys can also do it from age of 10.
Okay.
Corin, you can. I don't know if you definitely can share the recording. I'm very happy with that. That's fine.
No, and we will. I was going to mention that the recording will be shared next week. So everybody
Okay.
that's attended will receive the recording in an email. I often get a sharp pain on the right hand lower abdominal side after a few days after my period. Is that normal?
Yeah, it's usually the ovaries. So if your gynae's checked it out and everything is normal, sometimes one of the ovaries during a period sometimes just hurts a little, gets more tender and can cause a sharp pain. So it is quite normal to get that like ovarian pain. They say about 40% of women get that.
Okay, thank you. And is it normal for your menstruation to be a lot heavier after being sterilized at 21?
So normal is a relative term. Like some women don't have heavier, but some
Mm.
do. But I would definitely check if it's been a lot heavier, just to check that there isn't something else going on. If everything's okay, I always think of menstruation is extremely heavy. It's always good to get it checked, because it may not be due to the sterilization. It may just be due to, you know,
Mm.
some other condition that's going on. So I would get it checked out, because losing that much blood also can lead to anemia and that. So rather just get it checked.
Okay, I'm 38 and would like to get tested for my hormones. Can I go to a GP or should I rather go to an endocrinologist? And
You
what
know,
questions should I be asking?
what I'm going to do, where is that question? I'm going to type it here. Okay, so I would go to this lady. She's a GP. Um, in She is really good. She's a GP, so she charges GP rates as opposed to endocrinologist rates. But she is really wonderful. I'll actually send the details also to Corin, her number, that she understands the hormone. She's very reasonable, and she'll go through your whole history with you. I find general GPs don't acknowledge menopause and our hormones as well as they should, and endocrinologists are a bit cost prohibitive sometimes. So Terry's great because she'll like go through the whole checks with you. She'll send you for bloods, and it's like, and she can make up your hormones for you because she's got a dispensing pharmacy there as well. So it's like one shop stop. It makes life a lot easier for you. Okay.
Right. Is it normal for a 7-year-old to experience minor spotting, or is it a cause for concern?
I think a 7-year-old, I would like you to go and have that checked out. It's not something that normally happens, and for there to be spotting, there may be something else that's going on. So yeah, I would like you to take it to a doctor just to check that out.
Does HRT help with weight loss?
Yes, it does. So definitely, lack of estrogen can make you gain weight because of the cortisol rise. So when we get onto HRT, lowers the cortisol, and it definitely helps with weight loss as well.
I am currently taking B-cal, folate, iron, COQ, and estradiol. Is there something that I can take that will encompass them all? I'm 52.
There isn't really. I love what you're taking. I think it's an amazing combination, but there isn't actually a tablet that has all of those. But I think that what you're taking is a really good product. So, well, good product. So I would say stay on those. I know it's a lot of tablets, but it's a very good combo. So stick with that.
Is it okay to use any type of bone for making bone broth, regardless of the meat?
Yes, 100%. I mean, you can even make it with fish bones, but that would be disgusting. But any bones would be fine, actually.
Can I get HPV vaccine after 40?
So I did. So, I mean, I had a hysterectomy because of HPV. And even then, they said I should still get it done. So I had it done at the age of 48. So, yes, you definitely can get it after 40. Always good just to have it, because even if you've got HPV in your system, taking the vaccine will help prevent it from mutating into cervical cancer. So definitely take it if you haven't had it. I will warn you, it's a bit sore, but it's definitely worth doing. So you'll do one injection, 3 months later, the second injection, and 6 months after that, the third injection.
Okay, is heavy bleeding during periods normal for someone who has lost a lot of blood during birth, 12 months postpartum?
You know what? We shouldn't still be bleeding so heavily. It's obviously something happened during the birth that could have caused like a blood vessel
Mm.
to become weaker, and that's why we're bleeding a lot. So I would actually get that checked out. They may just need to like cauterize one of the blood vessels, because if this heavy bleeding started after that loss of blood during the birth, it could be that there's a blood vessel that is like weakened. So I would go and speak to a gynae about that and just have it checked out.
Yeah, there are two questions pretty similar, but really, at what age should or can a girl or boy or woman get
From
the
age
HPV?
10. So
Okay.
even from the age of 9, funny enough. So like they roll it out in the primary school. So if they're doing it there, get it done. So from the age of 9.
Okay, hi. I am 41. So what happened is that the last time I had a heavy flow was around March, then April. I didn't see my period. Then in May, I started to have irregular periods, like I can use one pad for the whole day. So does this mean I am in perimenopause?
It can mean you're in perimenopause, but sometimes irregular periods can also be cysts or fibroids, especially at age 40. So it could be cysts, fibroids, something else. If you're not having any other menopausal symptoms like no hot flashes, no sleepless issues, no brain fog, no irritability, like you're perfectly fine except for the like change in periods, maybe just go to the gynae, get checked, do a check that there's, nothing else going on. But yeah, I mean, it could be perimenopause, but it may be something else. So missing irregular periods doesn't necessarily mean perimenopause. It usually comes with some other symptoms as well.
Okay. How long does it typically take for a menstrual cycle to return after having a contraceptive implant removed at the age of 43?
Different people are different. So sometimes it can take up to 6 months for it to get back to normal. Sometimes those contraceptive implants, however, can bring on early menopause, especially when you've only taken it out at about 43. So they may not come back, but typically between 3 and 6 months it comes back.
Okay. Is it wise to hold on to the copper IUD contraceptive even though it has extreme period pains before and after periods?
I think if you're having extreme period pains with it, I would take it out and find an alternative. Okay. Extreme pain, like it's your body trying to get rid of it. So it's obviously not your body's reacting badly to it. It's almost trying to throw it out violently. So I would see if you could find an alternative to that.
Someone is asking how long should they be on hormonal treatment?
Okay, so they're saying these days with the hormonal treatment that we're on, you can actually take it for up until like you're 65, you can take it. So, but we actually had a woman who hadn't been on hormone treatment at all, and it had made her urethra, which is the tube that allows you to urinate, become very thick. So at age 72, we put her on hormone replacement because it thinned out that thickness. So they're saying with the hormones, you can actually stay on it until like 65, 70. We just like as you get over 60, we start lowering the dosages a little bit.
Okay, I think there's an error in this question, but it says here for those of us near, I'm not, it says
Okay.
Terry. Could
Oh,
you
yes.
provide us
So
with a checklist of
So
tests?
if you have a look when they send out the what do you call it, the recording, you'll see what tests you should have, and you can actually just take that list to Lancet, put my name on the Lancet form, and then they'll just send the results to me. So you can do that. That's not a problem.
Okay, what are your thoughts on Cyril's capsules instead of HRT?
Okay, so I'll be honest with you, I don't actually know Cyril's capsules, so I'm going to take a screenshot of this. Please message me. I'll look it up and ask some questions, and then I will get back to you about what that is because I actually haven't heard of it.
Okay, I heard that HPV vaccine makes children hypersexual. Is this true?
No, it's just one of those, myths. I think there are people who always will find like, things that are
Hmm.
they make up things, but no, definitely not. It doesn't do that at all. It's just a vaccine to prevent genital warts. It's got nothing to do with sexuality at all.
Okay, I'm currently on NovoFem. It's been about 6 months, helped with eliminating hot flushes. Do I need to take these for most of my life going forward?
So the thing is, the hot flashes usually only last for about, 12 to 18 months, and then they calm down. But when it comes to hormone replacement, the thing is we should be on it because as we get older, the hormones protect our heart, they protect our bones, they protect our brain. So it does help us, keep healthy for longer. But in terms of the hot flashes, those will settle down after 12 to 18 months. So you don't actually need to take treatment for hot flashes after about 18 months.
Pre and probiotic daily use, is it advisable?
Yes, 100%. I think it definitely helps with gut health. It just helps your intestines a lot. So always good to do that. There's a good one. He's in Woodmead, so he's not too far from Centurion. So you can try him. He's not too far from. I just typed it in a reply to your message.
Yeah, I see there's somebody else asking about
I'll look up those ones because I actually don't know them. Okay, so Tiffany, I see yours. There's cancer in the family, so I'm worried about hormone replacement. So I've had cancer twice, so I also worry. But what you can do is you can get the bioidenticals. So they're not actually estrogen, but they allow the body to think it's estrogen and like help with the menopause, but it doesn't stimulate estrogen in terms of the estrogen dependent cancers. So if you were to go on it, you would ask about a bioidentical cream, and that won't put you at any risk. Okay. And then the Pretoria specialist. So as I said, I don't have anyone in Pretoria that I know personally, but Dr. Gys du Plessis is in Woodmead. So he's not there. And he does on both Terry and Dr. Gys do online consults. So if you didn't want to travel, you can set up an online consult with them and they can do an online consult as well.
And just last question, what probiotic would you recommend for gut health?
So any of the ones that you have to keep in the fridge. Okay, so if you go and you get a probiotic, ask for one that you keep in the fridge. Any of the ones you keep in the fridge are good ones.
Kylee, thank you so much. It's been so insightful. And we definitely will share this recording with all the listeners. And thank you again. If you wouldn't mind, if there are any questions, I will pass on your email address to everyone as well. And we hope to see you again soon. And to everyone out there, thank you very much for joining us. And we will see you at the next one. All the best. Keep well.
Have an awesome day.